Regenerative stem cell therapy has many benefits, including reducing the amount of addictive pain medications one might need to take. Dr. Locks joins us now with two of his patients you may recognize. NFL Hall of Fame inductee Derrick Brooks and radio personality and host of the Ron and Ian Show, Ron Diaz. And they're here to tell us all about their experiences. And Dr. Locks, I want to start with you. For people at home who don't understand regenerative stem cell therapy, in really simple terms, what does it mean?
Well, regenerative medicine is the field that encompasses biologics, platelet-rich plasma, stem cells, and tissue engineering. Stem cells are basically our repair cells. They're in our body, but they're only capable of doing certain things, and we are meant to get old. We do not have stem cells as we, unfortunately, yes. That is the truth.
It's inevitable.
I have found Ponce de Leon's fountain of youth, but stem cells are not in our joints, so we break down, and if you have injuries or surgery, it accelerates that. So stem cells are a way of taking them from one area and putting them and helping them out to help us heal ourselves with our own body.
Okay, Derrick, 14 years in the NFL, so your body took a beating.
Literally.
So why did you see Dr. Locks? What was your issue?
Well, my issue really was my wrists, were my wrists and my knees. And one thing I always tell people about this in dealing with Dr. Locks is Dr. Locks takes the time to educate you through every step of the process. I played a lot of games, and I never had a surgery in my life in playing. So the thought of surgery, you know, from orthopedic was, you know, kind of scary. So he knew I didn't want to do it, and Dr. Janicki consulted with Dr. Locks, and they spent maybe a couple months really just kind of talking me through the process and really got to get my nerves, coaching me through the process.
Right.
But when I went in, we started out with my wrists. And at that time, the regenerative stem cell therapy the wrist wasn't that popular. It was more the bigger joints. But doc, you know, said, hey, the wrist will be great in doing it. And the area we went in and did both my wrists. And I called him up probably before and said, Doc, I know I'm supposed to see you till December. I like to really get these knees.
Right. So you were convinced after your wrists were done.
After my wrists, and we went in and we did both my knees. And I'm here to tell you, I've not had any issues since.
It's incredible.
It's going on probably, what, 2.5 years now.
That's amazing. Now, Ron, you played in college baseball.
Yeah.
You were a pitcher?
Yes.
So your shoulder was a little messed up.
Yeah, I think it might have been from that and working out, just being active, paddleboarding, just the things, the normal things that I do on a daily basis.
Right.
But probably 10, 12 years ago, I was pitching batting practice. I hadn't thrown in forever for Admiral Farragut High School.
Right.
And I did it 2 days, maybe 3 days in a row. And I was thinking, man, my arm is killing me. And then I look and I have a hole in my bicep, which is a torn bicep that I didn't even know. I didn't know that I did it. It wasn't like it happened and it hurt really bad.
Right.
It was just this dull ache. And then I told Dr. Locks about the pain I've been having up here as well. And when he did, I don't know if it was an MRI or an X-ray, but he found extensive damage. I think you said a tear in my labrum, a tear in my rotator cuff, and a bicep tear.
Okay, so really quickly, you didn't have to have surgery, you just had stem
I was
cells?
going to avoid surgery at all costs, and I heard you know, I've heard about Dr. Locks, we've known each other, and I thought, I'm going to do it. And it didn't hurt, which is, Ian had me thinking, this is going to really hurt badly.
But it didn't hurt.
It didn't hurt at all.
And you're fine now.
Yeah, my shoulder's much better. The way I can describe it before, I would have to do this motion, like if a sliding glass door is off its hinge, it's rough,
right?
And I would have to do that to get it back in place, and I don't do that anymore.
Well, there you go. Proof is in the pudding right there. Dr. Locks, thank you. And gentlemen, thank you for sharing your story. And for more information, call 727-462-5582 in Tampa Bay or 310-975-7033 in Beverly Hills. You can also log on to drlocks.com. Daytime will be right back, so don't go away.